Hello and welcome to my presentation on tetanus disease. Specifically, my bacteria is called Clostridium tetani. And so first off, we have a bit of nomenclature and taxonomy. Tetanus disease is the official name of the disease, and Clostridium tetani is the bacteria that causes it. A nickname for it is lockjaw because that is one of the symptoms, which we'll cover later. Here we have a phylogenetic tree, and you can see that it's related to Clostridium botulinum, as well as Clostridium perfringens and Clostridium difficile, which the difficile and perfringens cause gastrointestinal issues, and botulism is a neurotoxin similar to tetani. So here's some of the characteristics of Clostridium tetani. It is gram-positive, as you can see in this image, and it's bacillus, which you can see also with the very slender rods right here. It forms endospores, which are visible in some of the bacteria imaged here. And it's anaerobic, so the spores are present in soil, feces, and intestines, which allow it to survive. But the bacteria itself produces tetanospasmin, which is the neurotoxin that causes the disease. And so how the progression of the disease occurs, or the pathogenesis, is firstly spores enter a wound from soil or fecal contamination, and this is where there's a big misconception that a rusty nail causes it, but really it's the puncture wound from the nail causes an ideal anaerobic environment for the spores to germinate. So once the spores germinate, the Clostridium tetani is able to grow and produce tetanospasmin. And the tetanospasmin then goes through the bloodstream and connects to the central nervous system, causing affecting the central nervous system. So it can be transmitted to humans by spores in the soil or in feces. However, it's not transmitted person to person, which is beneficial in that there's not as much stigma around tetanus as there is around other diseases. Neonatal tetanus can be transmitted to a child via unsterile instruments used to cut the umbilical cord. However, a baby will not get tetanus if the mother is vaccinated. So it's really important for mothers to be vaccinated in order to pass on that passive immunity to the children before the child is born. And so here's the pathology of it. Once it gets to the neurons, it specifically targets motor neurons, and you can see here it binds to the interneurons that inhibit the release of signals, and like normally a muscle gets a signal from the neuron to contract, but when the tetanus toxin binds there instead, it prevents that release of the muscle and the relaxation of the muscle. And that's where you can get these symptoms such as lockjaw, which I have on a different slide, as well as rhesus sardonicus, or the Sardinian grin, and opisthotonus, which is the contraction of all the muscles in the body, versus the Sardinian grin is this one here where it's just the guy looks like he's smiling. Tetanospasmin affects the skeletal muscle specifically, which is, I suppose, benefit in that it doesn't harm the heart muscles, but there can still be overactivity such as drooling, sweating, fever, difficulty breathing or swallowing, and irregular urination or defecation. There's 3 different types. There's general, which is what you can see with the tetanic triad of the lockjaw, Sardinian grin, and opisthotonus. Or you can have local, so right where the wound is, that muscle there can start seizing up. Or cephalic, which affects the skull. And so then you have your immune response, which the humoral immune system makes the tetanus immunoglobulin antibodies, which you can see here, a nice little 3D model of the protein. And the antibodies are also used in some treatments, which we will cover later. And then the cellular immune response includes memory T cells, which are very beneficial, but after 10 years they wane. And so that's why it's important to get boosters every 10 years. And so how doctors can tell that somebody has tetanus is if they have any of the muscle contraction issues that we covered earlier. And specifically, there's a spatula test, which is where the idea of lockjaw comes from. So if a person has tetanus and you put a spatula, lightly touch the back of their throat, the motor neurons are a lot more sensitive to that stimulus, and the jaw will clench down. Versus if someone does not have tetanus, they'll have a gag reflex. They are also able to take samples and do a bioassay to see, to confirm that it is Clostridium tetani. And that's my references for pictures. And so a bit of history. The first time that it was recorded was 1500 BC in Egypt. Although that record is suspected to possibly even be a copy of an even earlier record from 3000 BC. So clearly tetanus has been around for thousands and thousands of years. In 1884, some scientists, Carlo and Raton, were able to take the pus that was from one of the wounds infected with tetanus and take that pus and infect a rabbit with the Clostridium tetani that was in the pus. And so that was, that kind of showed that that there is some bacteria that is an infectious agent. And then Kitasato was able to isolate Clostridium tetani, which is always a good step towards finding out more about the disease. And then he, as well as Emil von Behring, discovered the tetanus antitoxin. And another scientist showed that you can have passive protection from these antitoxins. And these antitoxins work by binding to the toxin, to the tetanospasmin. And that was really beneficial because tetanus affected especially soldiers in the battlefield because they were not able to get the medical help they needed to clean out wounds sufficiently. But the timing of the discovery of the antitoxins was especially beneficial for World War I in preventing death from tetanus. And then in 1924, the first tetanus toxoid was discovered, which they were able to make a vaccine out of, and that was again right in time for World War II, so it definitely helped save a lot of lives there. And then in 1947, tetanus became nationally reportable, which we can see on the next slide, the benefits of that. And in 2005, and I think there was also an outbreak in 2006, there were a few outbreaks in Indonesia and Pakistan after some natural disasters occurred. And so since becoming nationally reportable in 1947, cases have decreased 95% and deaths 99%. And this just goes to show you how when you have a good system in place of vaccines and treatments, you can really cut down on the terrible effects of a disease. So in 2017, there were only 23 new cases in the US and 79,000 new cases worldwide. And of those, only, six deaths occurred in the US and 38,000 occurred worldwide. So you can see that is actually still a very high rate of fatality, but we have been able to knock those down quite a bit. And so the tetanus outbreaks that occurred in Indonesia and as well as Kashmir, and I think there was one I came across with Pakistan, there were only a little bit upwards of 100 cases, but you see they have a high case fatality ratio of 18.9%. And this is the reason that there were these outbreaks isn't so much that we didn't have a cure, because obviously we do by 2005, I'm sure you guys all probably got vaccines for tetanus before that. But the issue is just like supply chain and making sure that everybody who needs it gets it. But obviously in the case of natural disasters such as earthquakes and tsunamis, there's just so much going on that things like that can slip through the cracks and people not get the treatment they need. So the treatments that there are is the toxoid vaccine, which you can get in conjunction with the two other diphtheria, and so you get like Tdap. And that is just, they take the tetanospasmin that and turn it into non-toxic form, and by putting it in, it's kind of similar to an live attenuated virus kind of idea, where it's a weakened form of it, which therefore stimulates the formation of the antitoxin. And then the antitoxin is another form of treatment. They can just put it in through an IV if someone has tetanus, and this provides immunity that neutralizes the toxin. However, this only helps neutralize the toxin that is circulating in the blood and lymph, not the toxin that is already bound to the neurons. You can also get supportive care that will help with any breathing issues or things like that, but they do not recommend using antibiotics in treating this disease. And so the people who are most at risk, pertussis, that was the other one I blanked on. The people who are at risk are those who have not been vaccinated or those who have not kept up on their boosters. And for this reason, the elderly are especially at risk because it's very easy for them to fall behind on their regimen, or for if they're in a nursing home or have some sort of for memory loss issues, then they might forget if they have been on top of it or not. And so yeah, that's some dangers. And children that are under 5 years old might not have gotten protection, especially again with the neonatal case with that passive immunity. So future research and outlook. There is continual distribution of vaccines, especially in the midst of natural disasters. I think we really ought to look into ensuring that everyone who needs a vaccine can get one, and also to continue to research to understand the mechanisms of how it works and of how the toxin works and how maybe we can utilize it, such as I read one paper said Clostridium botulism, or the botulism is able to be used to help with tetanus. So, there's maybe some interplay there, and also to encourage people to continue to get vaccines, because there's sometimes a forgetfulness of the importance when it's almost near eradication, but still definitely important. So here are my references, and thank you for listening today.